Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Today, Stephanie Desmond talks to Dr. Craig Pollack of Johns Hopkins about his recent publication linking better housing conditions with better health, most notably asthma. The paper follows kids whose families were giving housing vouchers as part of a Fair Housing Act settlement to address discrimination and structural racism. Let's listen. Craig Pollack, thanks so much for joining me.
Thank you. A pleasure to be here.
So today I want to talk to you about this recent study that you did. It was about poverty and asthma and a very unique opportunity to study the links. So I'm wondering if you could sort of tell me how this came about.
Sure. For this study, we partnered with an organization called the Baltimore Regional Housing Partnership, or BRHP. And the organization is a really interesting one. They were started as a result of a fair housing lawsuit, which was brought against the U.S. Department of Housing and Urban Development. And as part of the remedy for that lawsuit, they created these housing vouchers and a system to help individuals who wanted to move from areas where there was a lot of poverty into lower poverty, or what they called opportunity neighborhoods. And so we were interested in what happens to the health of families and children as the families move with these vouchers and these supports to help them address the obstacles that prevent them from moving in the past. And really, we were interested in what happens to kids with asthma as their families get the chance to move.
So this is really just came out of a century of racism, right? I mean, this goes back to redlining and all of the housing discrimination that there's been over the years.
Exactly. This type of program is really designed to try to help remedy the ills of our housing system, the systemic racism and segregation that has existed in the past and in many places continues to exist. And so programs like this are, I think, a really important model, and they really provide a lot of insight into what we can learn about health.
So what do we know about asthma and what causes it?
So there's a tremendous amount that we know about asthma and asthma triggers. And we also know that about a quarter of kids in urban environments have asthma. So it's a tremendous problem causing a huge number of hospitalizations, emergency department visits, healthcare costs, and real problems for the children and their families, right? These are days missed from school. These are time taken off from their jobs. So it's an enormous problem. And we also know that there's a large number of triggers in different environments, especially mouse and cockroach allergens when we're talking about Baltimore City. And so we were interested in to what extent does moving change levels of these allergens, these asthma triggers, and what else is going on in the environments that might be causing the changes in asthma exacerbations.
So what'd you find?
So the results were really striking. What we saw is if for every 100 children, we saw there were about 88 severe asthma attacks every year before they moved. After moving, there were approximately 40 asthma attacks per year. That's a reduction of more than 50%. So really large reduction, kind of on the order of some of the medicines that we use to treat asthma.
Mm-hmm. So it was like the equivalent of giving someone a corticosteroid.
Exactly. Like the equivalent of giving someone an inhaled corticosteroid, kind of on that order of magnitude. So these findings are really striking. And I think as important is we looked into some of the reasons why, and we saw that there were reductions in some of the allergens, especially mouse and cockroach allergens. Some of the allergens also increased, such as dust mite allergens. And in this setting, the study wasn't really designed and powered to look at, for people that are sensitized to these allergens, is the changes a result of these reductions. It didn't seem to be the main factor, and the study, I think, isn't able to disentangle that, and we know from a lot of research that these factors are important. But instead, what we found, and I think this is really critical, that it was changing levels of stress, and especially stress related to one's environment, the feelings of safety in one's neighborhood, walking around in the day, walking around at night, that seemed to be a huge factor in reducing children's asthma exacerbations. And this kind of builds on the idea that there's stress is important for multiple reasons and multiple parts of our kind of body and health. And this contributes to that line of research.
So how did you measure stress levels?
So the way the study was designed was we did home visits with families and when they first entered this Baltimore Regional Housing Partnership. And then we did telephone calls every 3 months and did home visits every 6 months thereafter. And so we were getting really careful surveys of what was their level of stress, how were they feeling about their neighborhood environment very frequently. At the home visits, we also did vacuuming and air filters to try to measure some of these other asthma triggers that we know about. So it was really by the parent report that told us about kind of the stress that they and their family were experiencing.
So stressful environment can trigger asthma?
That's the idea that stressful environments can be one factor that increases people's risks for asthma. And I think this is really important to consider because, a lot of our approaches to dealing with asthma are often focused on kind of individual home remediation. There's kind of, you're going to people's houses and you're doing different things to the people's houses. And those can be really important programs, but they fail to address these kind of confluence of other things that are going on outside of people's homes, in people's neighborhoods that may be contributing to the asthma exacerbations that children are experiencing.
So this is just a really amazing finding that you have here. What do you think it tells us sort of for the long term?
Well, so that's a great question and something that we're actively studying right now. We're continuing to follow up these households and children to understand what happens to children's asthma as they move in, as they remain in their homes for longer. One of the things that we're really excited about is understanding what happens to children's lung growth. And this is incredibly important because as my allergy and immunologist colleagues tell me, that our lungs continue to grow for a time during our childhood and into our young adulthood, and then it declines over time. And that if you're able to change the lung growth trajectory, the kind of rate at which lungs grow, and the kind of the peak lung function, then that can have really long-term implications for adults' lifespan.
So now you move folks from neighborhoods with very low income to significantly higher income. Is that a reasonable sort of thing to be able to do, to be able to scale?
So I want to be really careful here about the language we use. So these are individuals that signed up for the program. There's a tremendously long wait list for these vouchers that are offered. And this is really about helping families overcome the obstacles to moving, helping them with security deposits, helping them with finding landlords that are going to accept their vouchers through a host of different supports that are offered. And so this is not about kind of moving people that don't want to be moved, but it's creating opportunities for people that are sometimes systematically blocked for individuals. And so I think these types of mobility programs are really important and are being tested at a larger scale. The U.S. Department of Housing and Urban Development has a program that's testing strategies to help people across a number of different cities and seeing kind of what works in this environment. At the same time, I do think it's really important to say there also needs to be place-based strategies. Not everyone can move, not everybody is interested in moving, and not everyone should have to move, right? Like there needs to be communities and environments that support health regardless of where you want to live. And so I think that this research speaks to the fact that we need to think about kind of stress in communities and how to support that.
So because only a small number of people really can benefit from this.
Well, I think that's on some level a matter of perspective. The Baltimore Regional Housing Partnership has helped about 4,700 families currently, which, I think for those families, that's really quite meaningful. I think there's hope that these types of programs can also be expanded to create these opportunities for families that want to move to a more resourced neighborhood, at the same time supporting places, build resilience and increase safety, reduce levels of stress, across the city and across many different places.
So it's really a twofold thing, right? So you want to, whenever possible, move the people who want to go into these higher income neighborhoods, and then the people who are staying in kind, making their lives better through improving their surroundings.
Yeah, and I think it's about creating opportunities for people that have often been blocked. And so I think that sometimes these mobility strategies and place-based strategies are pitted against each other in a zero-sum game. And I think we need to recognize that both are possible and that both are kind of important options for families that to make the choices that they want to make, and ensuring that these can be as healthy options for families, and helping us understand some of the, in a deeper level, what we know about asthma and equity in asthma.
So what other avenues do you want to pursue in this area?
So we're really excited to see what happens to these rates of asthma exacerbation over time. We followed people for about a year after they moved. So we're following up these group of families for longer to see whether or not these asthma reductions persist over time. And we're really excited to see what happens to lung function over time, again, because of the long-term implications for well-being and throughout the life course.
I saw in the commentary that came along with your JAMA article, the authors used the words housing reparations. I'm curious your thoughts.
I think that it's a great question. And I'm so glad that commentary came along with that piece to raise these policy issues. And I think that, this group of children and families that we were studying came about as a result of a fair housing lawsuit, trying to redress the wrongs that led to the segregation and disinvestment in neighborhoods. And I think there's got to be ways and approaches, reparations potentially being one of them, to help make the system better and help support children's health.
This link between health and poverty is it understudied, I imagine?
I think that there's got to be more recognition that asthma, rather than being an individual problem and an individual household problem, is also a problem of communities. And it's not just about the individual, but it's about places and where individuals live.
Craig Pollock, thank you so much for joining me.
It's a pleasure. Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.